Thank you, Andrea. Thank you all for having me here today and to be able to talk with you about measles and the current outbreak that's going on nationwide. And then the link to vaccines and certainly some troubling challenges that we've had across the country with growing anti-vaccination feelings. And so I appreciate the opportunity to really address both of those topics today. I'll start with measles in general and then maybe talk about the current outbreak. And again, just grateful for this opportunity to be speaking with all of you. So what is measles? A lot of us have been hearing a lot in the media, but just to sort of start at the beginning, measles is a tremendously contagious infection. You can be infected simply by breathing air that somebody who had measles coughed, sneezed, and potentially even just breathed or spoke in for as much as 2 hours after they left the room. So these particles of the measles virus stay in a room for quite some time. And it actually is a very effective vaccine at infecting folks. Okay.
More into it.
All right. Is that a little bit better? I can talk louder too? Okay. Sometimes the height is a disadvantage. It's also very infectious. So if you're exposed to measles and you haven't been vaccinated, 9 out of 10 individuals will go on to actually become infected. And unfortunately, it causes a pretty severe illness. Typically most people are going to get fever. There's a very classic rash that we're all taught about in medical school that measles produces. But it can also produce some pretty severe illness. It can cause a pretty severe infection of the lung. It can cause a severe infection of the brain, and even, unfortunately, lead to death, especially amongst the most fragile people in our society, the very young, the very old, people who are having difficulties with their immune system, perhaps because they're undergoing cancer treatment or for some other reason. All of that is really important for us to understand and potentially even terrifying. The good news that I have is we have an effective vaccine to avoid all of that. And so it need not be that we have to have as many people as we currently have nationwide with this current measles outbreak. And we've had an effective vaccine since 1963, and really over time, the vaccine has continued to improve and only gotten better. And it is now part of a series of other illnesses that we also vaccinate against. Classically for measles, we lump together measles with mumps and rubella. And those are also potentially very serious infections that we've also been able to really manage effectively through vaccines. So as a result of that very effective vaccine, improved vaccine over time, significant scientific study, public health efforts, and policy work, we actually as a nation were able to achieve elimination of measles in this nation in the year 2000. And it's a huge accomplishment, again, of really multiple swaths of society. But unfortunately now I stand before you talking about an outbreak of more than 700 people in this nation, affecting more than 22 states. So I think one of the reasons you have me here is to talk about, well, why is that the case? If we can say in 2000 we eliminated, why are we here? The last major outbreak that we had of measles that's anywhere comparable to this was in 1994, when we had an outbreak of about 963 individuals, and that was 6 years before we went on to actually eliminate the disease in the United States, at least the endemic. According to the Centers for Disease Control and Prevention, the current outbreak seems to have been measles introduced from countries where they're having their own challenges with outbreaks, specifically Israel, Ukraine, and the Philippines. That's not new, actually. We have continued to have imported measles really since the elimination. In fact, in the year that we eliminated measles in 2000, 60 cases actually happened in that year, but they were all importations from external sources. And so the key challenge right now is that measles is actually growing internationally. So those countries that I mentioned, Israel, Ukraine, Philippines, all have their own pretty severe measles outbreaks that are taking place. And actually more broadly, we're seeing measles globally on the rise. But really, that hasn't had an impact in the United States until recently. And so the question is, what's different? Why now, even though we've had importation of measles every year since elimination, and even during the year of elimination, do we now have this severe outbreak in the United States? And put simply, we're behind the 8 ball on protecting ourselves. The things that allowed us to achieve elimination in the year 2000, effective vaccination early in childhood, really broad coverage of the populations that we need to be reaching, which is everybody, have been slowly eroded over the last 2 decades with growing concerns about vaccines. There's always been general concerns about vaccines, and I'd say just as a primary care physician, there's always concerns about sort of any new treatment or any established treatment from a small subset of folks who may question Western medicine or methodologies or wonder what are the motivations for physicians. But this particular movement has been different than that general trend. Really, it had its birth in around 1998. There was a very famous study done by a physician in the United Kingdom whose name is Andrew Wakefield. The study has since been retracted because of poor scientific methodology, questionable motives, and just scientific soundness. And Dr. Wakefield is no longer Dr. Wakefield and actually has had his medical license revoked by the United Kingdom authorities, all because of this initial study linking the measles, mumps, and rubella vaccine to autism has been very soundly debunked, and essentially they've raised concerns about the methods that Dr. Wakefield had used and Mr. Wakefield had used to really start a concerned movement around the link between autism and measles. Before I go any further, I just want to emphasize and just put a very fine point on it. There is not now, nor has there ever been, a legitimate link between MMR, the measles, mumps, and rubella vaccine, or any vaccination, and autism. And our knowledge of autism has also grown since 1998. We have evidence that signals of autism and really signs of autism begin even in utero, meaning during, before birth. And so even before somebody has a chance to be exposed to vaccine, we see that there is autism. And so it doesn't really follow necessarily that needs to be linked to vaccines. Unfortunately, though, for whatever reason, even though there's always been concerns in general, this particular one has been very sticky, meaning that the public has really latched onto it. And instead of just a small group of people being concerned, we see that this has really grown. And now we have bigger parts of our society that are showing broad flavors of vaccine skepticism, whether that's concern about having too many vaccines all at once, or concerns about individual vaccines, or concerns about components. Unfortunately, the net effect of all of that concern is that we're seeing vaccination rates start to decline. And just as we're seeing now with the outbreak of measles in this country, that has real consequences, really concerning consequences for public health. Given how potentially life-threatening some of these diseases can be. The reality is, though, despite all of this concern, vaccines have never been safer. We have now so many data sources that we're able to track the vaccines that are going on, or the vaccinations that are being given around the country, both rigorous scientific studies to get them validated in the first place, and then post-market data capture from the Food and Drug Administration. We know that vaccines are very safe and effective. In the case of measles, mumps, and rubella, 1 dose of that vaccine is 93% effective, and 2 doses are 97% effective. The challenge is that, as I said, measles can infect 9 out of 10 people exposed to it, so you really need both of those doses. This is not one where we can hope that 60% herd immunity, that sort of everybody else is vaccinated so I'm safe concept, is going to be enough to protect people. The reality is, with something like measles, mumps, and rubella, most people, if not everybody, needs to be vaccinated. Meanwhile, serious complications from that vaccine are extremely rare, 1 in 10,000 to 1 in 1 million. And the current epidemic has really been focused on a couple of very close-knit communities where people are living relatively close to each other, and that there's high levels of vaccine skepticism and low levels of vaccination, specifically in New York and Washington. So far, there have not been any epidemic cases in the state of Louisiana, and we're very fortunate for that. Though we did have 2 cases of measles that were brought in from another country in 2018. Nevertheless, we are seeing growing numbers of Louisianans reject vaccinations, show concern about vaccinations, and start to really turn our numbers of good coverage of vaccines in the wrong direction. And so, as a public health official, I'm here telling you that I'm concerned. If these trends continue, we're not just worrying about New York's and Washington's, we're worried about what could be happening in the future in our own state. And these diseases have really devastating consequences. So once again, I'm really grateful that you're having me here today, because I think you and I share a common goal, which is to inform the public so that folks can protect themselves, keep themselves healthy and happy. And I think the media plays a really critical role into that. And I'm certainly not here to tell you how you do your job, and actually I've been very appreciative of how much outreach that all of you have done to members of the scientific community to make sure that good facts are getting out there. I will note that one of the concerns we have in public health is really the potential for giving equal time to something like a fringe concern around vaccinations and the really mountains of public health and research data that show that vaccines are safe and effective. The challenge to that viewer at home who may not yet have formed an opinion or may be very sort of vulnerable to influence is that they're seeing now an issue on equal footing, and they think that they essentially have the option of choosing 2 equally supported ideas and trying to decide personally where their preference sits. And in reality, it's not an equal fight. There is a very small group that have these concerns, and certainly they're welcome to have concerns about vaccines. And vaccines are ultimately an individual decision, but the data are clear and not even close. The vaccines are safe, they're effective, and they're really critically important for the health of everyone, especially those in our families. So I implore you and support you continuing to cover this story. We in the Louisiana Department of Health and the Office of Public Health are happy to answer questions and continue to point you in the directions of other knowledgeable medical and public health experts who can help with questions as they come up. And again, I thank you for your time today, for letting me share this information and this message to help keep Louisianans informed and safe. And I'm happy to take any questions at this time. Please, yes, sir.
Lots and lots of resources apparently have gone in to disprove this autism vaccine issue. Lots and lots of dollars look like they've been diverted. On a national basis, is it possible or a suspect that a national concern such as Russia or other entity is fueling this issue that's gone on for years, and thus has removed lots of medical dollar resources to prove this false? Is that not a possibility that to disrupt our society, that there's a basis in that fashion?
So the question was, there's been a lot of money and effort put into studying the links between not just the measles, mumps, and rubella vaccine, but other vaccines and autism. And I guess the question is it possible that all of that effort is being driven by some outside force, and you specified Russia, that could be doing that to take us off course and waste our efforts? And I'd say that's beyond my area of expertise, and I haven't seen any data like that, so I can't speak to that. You know, I will say I think it's perfectly reasonable as a parent to be concerned about what my children are being exposed to. I understand that, and if something's new or there's a new treatment, and again, as a physician, my job when I counsel my patients is to explain the level of evidence behind something. That I think is not something that in any way I question anybody's right or desire to do. What I think our concern is in the case of vaccines is that when we do build this very clear evidence, we're seeing just a continued rejection of that view. And so I think there is a certain point at where we feel like we have answered that question. And again, as you noted, there have been years of studies on this question. Thank you. Yes, sir.
Are there any socioeconomic or geographical barriers with this? Are there some regions of the country, say, more urban, more rural, that are more, that you're seeing more cases, or in terms of socioeconomic, more poor, more wealth? You know, what is the difference there?
So the question is, with the current outbreak, are there any socioeconomic links, whether it's level of wealth or level of density, because you said, rural versus urban, that we're seeing associated with this current outbreak? So that analysis has not been firmly done. What I'll say, though, is for this disease, you do have to be relatively close to each other. So I think where we have seen the epicenters of the outbreak, it's been in communities where there are people living very closely with each other. Yeah. Yes, sir.
So my question is on the MMR vaccine. So there was a Dr. Zimmerman testified in a proceeding on autism, where he said that there are exceptions in which the vaccines can cause autism. Are you familiar with Dr. Zimmerman's testimony, or can you at least comment on the exceptions that may exist where?
Sure. So the question was, there was a Dr. Zimmerman who testified, and I didn't catch where you said that Dr. Zimmerman might have testified.
He testified at a HHS omnibus autism.
Okay, so for the Department of Health and Human Services, some maybe vaccine or autism review board, and had said that there are occasions where autism is linked to vaccination. And the question was, am I familiar with that? And the answer is, I'm not familiar with that. I will say, again, everything that I've seen as far as data and evidence does not support that. In fact, in 2004, the Institutes of Medicine, now the National Association of Medicine, National Academies of Medicine, did a comprehensive look at the research data at that point, and had a consensus statement speaking essentially for the medical community, saying there have not been any links, credible links, that I'm aware of. Yes, please.
Coming off of that question, so if there is this Dr. Zimmerman who is saying if a child has an underlying condition, they get the vaccination, it will cause autism. Isn't that something that needs to be looked into?
So the question was, following on the question about Dr. Zimmerman, if there is a physician anywhere that's expressing a concern like Dr. Zimmerman, that there is maybe an underlying, let's say, predisposition that a vaccine could sort of create autism in somebody who's maybe would have a predisposition, is that not something that the scientific community should look into? So I'll tell you, I have not personally read all autism studies, so I don't know if that's a question that we've already answered. What I'll say is, again, I think healthy skepticism is something that I encourage, and I think the scientific community has really tried to go above and beyond in trying to answer these questions, because, again, this issue is so sticky. I can't speak to whether there's been that specific study conducted.
Well, then is it actually 100% accurate to say that vaccinations are not at all linked to autism?
Well, so the question was, then, is it accurate to say that the vaccines are 100% not linked to autism? What I can say is that all of the evidence to date certainly shows that there is absolutely no link between vaccinations and autism. You could imagine that there's a nearly infinite number of studies that could be done, or iterations, to really exhaust that question. But really, I think that we would see a signal at the point that we've done this much research, and we do not. Yes, please.
Dr. Billioux, as a physician and a public health leader, what do you find is the best way or the most effective means to persuade those who believe vaccines cause autism, or who believe that there are other problems with vaccines, that vaccines are actually safe and effective?
So the question was, as a public health leader, what do I find, or what am I aware of, are the most effective ways to really convince people who are concerned about vaccines in general, and maybe specifically in the case of the link between autism and measles, that vaccines are safe, that they're effective, that they should be taken. And I'll say that, I don't have a good answer. I think we are challenged right now in public health to understand what is an effective message. I think we have a tendency in medicine and in public health, just because of who, my background, I know that I'm somebody who's convinced by data. And so I think if I bring more data to the table, that's going to be what convinces someone. And I think that that's probably not the right tact. I think trying to understand where somebody's coming from, and that's where I'm talking about as a parent. I think that I definitely understand concern and fear, and for parents who are raising children with autism, the wanting to understand and answer for where did this come from. And I think starting from that point of compassion to say, okay, I understand why you're here, and even if this is not a link, that doesn't mean that we don't need to work really hard to find out what is a cause of autism, what is something we can do for autistic children, but not have the conversation just be about something that I feel we've put to rest, which is there is no link between vaccines and autism. My hope is that those kinds of discussions, as well as just in general people having these broader conversations in our communities, and seeing the really negative effects of doing something like skipping vaccinations altogether, does change the tone of the conversation over time. But I wish I had a silver bullet. Yes, sir.
As a public health official, what do you make of an elected official who stands up and says, when I was young, there was no such thing as autism or dementia, and then tries to link vaccines to those two ailments? When I was young, there was no such thing as HIV, but it certainly wasn't caused by vaccines.
So the question was, what do I make of an elected official, raising concerns about vaccines and relying on not being aware of an infection over their childhood and autism as a link to, now that we have a lot of vaccination, there's autism. I hope that's a fair paraphrase. So I'll say again, I think fundamentally, whether it's an elected official, a member of the community, a parent, really anybody, everybody has a right to their opinions and to their views, and I understand where, again, people draw correlations and are concerned. Where I'm more focused is, we know that that's not a link that's valid, and so how do I get the message out to folks so that they understand I really have no ulterior motive. I'm not on the payroll of any pharmaceutical company, not on the payroll of any sort of group that's getting money out of this. My only goal as the public health, the leader of public health in this state, is how do I get folks to be protected from the infections that can really kill and injure us. And my hope is that we can have those kinds of conversations and have it be about data and what we've seen, and going forward, hopefully, see more vaccinations. Yes, ma'am.
Why is it that Louisiana has escaped this? What's going on in Louisiana that we don't have this problem?
So the question is, why is it that Louisiana has escaped the outbreak so far? Why don't we have that problem? Here I'll say that I think we have a really good policy in Louisiana in getting vaccination. Vaccinations are required for school, with exemptions, but vaccinations are largely required for school. We actually are very highly ranked in the United States. I want to say 17th in the country for our level of vaccinations at school age because of that policy. It's a really effective policy. It's really important. The challenge is that we are we have one of the lowest rates of vaccination at the age of 2. So by the time it's mandatory to be vaccinated, we see that we are really leading. But before that, we have a challenge in getting people in to see their providers, to see, at these days you can certainly come to our Office of Public Health parish health units, you can go to pharmacies and get these vaccinations. It's just not happening at a young age. So my concern is that most vulnerable population, the group before school, vulnerable to death from measles, those are the kids who were not getting the same level of vaccination that we would want. So that's where we really need to get our numbers up and the message out. Yeah, follow on question.
How are you monitoring this, or?
The question is, how are we going to address that in public health? Well, through a number of different ways. One is opportunities like this to go out and speak to a broader group. Again, I wish we weren't in this situation as a country, but where we are now is having a dialogue about something that's really been brewing for 2 decades that we haven't been talking about in public in the way that we're talking about it now. So I think this gives me an opportunity to talk about the value of vaccines. And there may be people who have no objection to vaccines, but just haven't been motivated to get their children to the pediatrician or otherwise to get vaccinated. So I think one is taking advantage of these kinds of situations. The other is continuing to work with the providers across the state and frankly the insurance companies across the state to really make sure that we're providing the right tools and incentives to help both providers and families understand the importance of vaccination. So that's an information campaign that's working through our insurers, certainly in Medicaid. We work on that through quality measures, really try to get folks to understand the value of vaccination and increase our rates. Go back here first.
Point. Is it typical for the MMR vaccine or others to be provided at no out-of-pocket cost to consumers?
So the question is it typical for the MMR vaccine to be provided at no out-of-pocket cost for consumers? So I'll say it probably varies. I don't know the answer to that. I think it depends on the insurance scheme. I'll say in Medicaid, we do cover MMR, and actually nationally, children who are served by Medicaid have higher levels of immunization than even commercially insured children. So I think that really reducing those barriers to vaccination is one of the most important things we can do. And at the Office of Public Health, we provide vaccinations as well. And especially around flu season, you probably heard a lot about us trying to really get the message out that no cost to you, we're gonna make sure that there's no barrier between you and a vaccine. Yes, sir.
Regarding MMR safety, so it's my understanding, something that came out of the recent request from the Freedom of Information Act was that the government has conducted no studies on vaccine safety in the last 30 years. Really with this.
So the question was related to the MMR vaccine again, measles, mumps, and rubella. There was a recent Freedom of Information Act request to, I'm assuming HHS, that revealed that there's not been any research in the last 30 years on the vaccine. So I'm not aware of that request or the details when it was filed or anything like that. I'll say that I don't believe that to be the case. Yes, please.
Doesn't the MMR form that you'd have to sign at the pediatrician's office, it states that don't take this vaccination if you have allergies to ABC, whatever. If you're usually breastfeeding a child and they're still breastfeeding, but is it possible that you wouldn't know that they were allergic to something? I mean, how would we know that? Particularly if maybe eggs in the case of the flu shot too.
Yeah, so the question was, for actually all vaccinations, when you receive a vaccination, you're given an information sheet that lists certain allergy components or things that people should be aware of if they're a part of that vaccine, so that you don't receive the vaccine if you are actually allergic to one of those components. And then you asked, for women who are breastfeeding their children and the child has not yet obviously been exposed to a lot, is there a concern there that there could be an allergic reaction? So I'll say in general, especially for breastfeeding mothers, the child is getting the mother's immunity through the breast milk. And so we usually do not see those kinds of reactions in a baby that's actually of breastfeeding age. Increasingly, the American Academy of Pediatrics is really talking about a stance of exposure to more materials earlier in life rather than avoidance, because it actually seems to show that it reduces likelihood of having allergic reactions down the line. Now that being said, if there's any sign of allergic reaction either in a baby or any other individual, make note of that, talk with your primary care physician or primary care provider, and avoid that allergen again. And there are folks who have those concerns with components. They're extremely rare, but folks who do have allergic reactions to components of the vaccine, and for them, I would certainly recommend go with your doctor and your provider's advice there. Yes, sir. Question in the back.
I'm only asking about Louisiana, and I'm only asking about from your perspective. Okay, that's currently being implemented. Is there anything about the Affordable Care Act that acts as a disincentive for folks to get MMR?
So the question was, in Louisiana, and from my perspective, is there any aspect of the Affordable Care Act that can act as a disincentive from getting vaccinated in general or the MMR vaccine in particular. To my knowledge, there isn't. It's a covered preventive service, and the Affordable Care Act laid out that those have to be accessible to everybody regardless of insurance.
And we're letting people know that.
Well, hopefully we're letting people know that right now, but we need to do that more if people aren't aware. Yes, sir.
Did you tell us the ages or the timing of when a child's supposed to get the MMR vaccine? Have you done that?
So the question was, have I told the ages when people should be getting the MMR vaccine and the timing? And so I haven't done that today. I'll say I would recommend engaging your family pediatrician or primary care provider to give you the full schedule, and they can lay out the schedules of shots that start around 6 months. And
We also have it on our website.
Great.
I'm happy to share this with you.
we also have that information on the LDH Office of Public Health website, and we can share links with members of the media as well. Yes, please.
You spoke about that you're starting to see an increased number of people who are not getting vaccinations. Do you have any stats on that?
So the question was, we're saying that we're seeing an increase in the numbers of people who are not getting vaccinations, and then do I have statistics on that? So what we really track most closely, so it's hard for us to know population-wide who's not getting vaccinated. What we do know is who's seeking an exemption from vaccination at school age, and we've seen we normally have about 0.5% of folks that raise that concern, and that's risen to 1, so essentially like a doubling of that population. Now, it's still rare, we're talking about 1% of the population, but that's concerning to me as a public health official, because that, again, tells me that we're starting to see traction of this concern within our own state, and that is not too far from then one of these 2 cases in 2018 that comes to the state with measles, suddenly finding an environment where measles can spread and having a potential for an outbreak in this state.
Is that 0.5% to 1% only in Louisiana? Or?
That's the question was, is the 0.5% to 1% only in Louisiana? Yes, ma'am. Are there any further questions? Well, again, I'm really grateful for your time, grateful for you getting the message out. And again, if you have any questions or anything like that down the road, we're always happy in the Office of Public Health and the Louisiana Department of Health to try and answer those questions. Thank you so much.